Hello, my name is Brandy Turzin. Today I'll be discussing the role of nursing sensitive quality indicators, otherwise known as NSQI. These are identified by the National Database of Nursing Quality Indicators, NDNQI. The NDNQI is a, quote, voluntary database of unit-specific quality indicators that are specifically related to nursing care. These were established by the American Nurses Association, or ANA, in 1998. The NDNQI is a national database. It serves to measure nursing quality. The ANA developed the NDNQI in 1998 to monitor nursing-sensitive quality indicators that are vital to patient safety and quality improvements in hospitals. The NDNQI collects and evaluates specific nurse-sensitive data from over 2,000 U.S. and international hospitals. These participating hospitals benefit from the routine reporting of nursing quality measures and national data that serve as a tool in quality improvement. Nursing quality sensitive indicators, or NSQI, are categorized into three groups. These are structural indicators, process indicators, and outcome indicators. This breakdown is useful because it aids in defining the area in which an issue is arising. Structural indicator includes issues like staffing ratios, skill level, and education and certification of nursing staff. Process indicators measure methods of patient assessment and nursing interventions. Outcome indicators depend on quality and quantity of nursing care. The NSQI I am discussing today is patient falls. Falls are a common adverse event occurring in hospitals and pose a challenge to healthcare quality. Around 30% of falls result in injury, particularly among the elderly patients. The injuries sustained from a fall can increase costs and increase length of stay, burdening the hospital and the patient. There is a factor of increased morbidity and mortality resulting from the fall in an elderly patient. Nurses are at the forefront of preventing falls. Organizations are directed by national recommendations by the Joint Commission of Hospital Organizations, otherwise known as JCO, to use a valid and reliable fall risk assessment tool initially, and to reassess fall risk regularly, and to establish interventions to create a safe environment, customize and individualize interventions for patients at a moderate to high risk of injury. Leadership support is essential. Turner et al. 2020 grouped this support into three groups: expectations, rewards, and support. Expectation referred to updates in hospital fall policies within the past 3 years. Rewards came in the way from leadership of incentives like gift cards, public recognition, and pizza parties for the units with the lowest fall rates. Support included education for the units that achieved a lower performance related to the incidence of falls. An interdisciplinary approach to prevent falls for patients would include a fall prevention committee. This committee would meet frequently with the interdisciplinary team to discuss the patient's condition and risk for falls, recognizing the need for individualized fall assessment and fall plan for each patient. The team can review medications, PT/OT assessment, the use of fall alert bands and signage, and proper documentation if a fall occurs. Education is also key in preventing falls. This includes patient teaching on use of the call bell system for ambulation and assistance in ambulation to the restroom or out of bed. Staff should be aware and educated on use and availability of assistive devices. Family members also need to receive education on how to properly assist a family member and also to request assistance with movement and ambulation of their loved one from staff. For example, I work in an ambulatory care setting where patients are sedated with IV anesthesia for their procedures. We complete a fall risk assessment with a number score associated with fall risk criteria upon admission. This is entered into the EHR and also on paper documentation. If the patient scores above a 25 on this fall risk assessment, a fall alert band is placed on the patient's wrists and fall alert signage is prominently displayed on their stretcher, along with verbal communication and our informal handoff to procedure room staff and then again to recovery room staff, from where the patient will be discharged. This is per our fall prevention policy. Should a fall occur, we are required to document it, submit an incident report, and management submits this information quarterly in our reporting of adverse events. Each patient is also assessed for injury and, if needed, transferred to a higher level of care if assessment determines an injury or the need to rule out injury. Falls are preventable but can still occur as a result of many factors. These factors include age, balance issues, confusion, medication, and anesthesia side effects. Being vigilant of your patient's environment and assessing their risk for fall upon admission can help in the reduction of falls or preventing them completely. Frequent monitoring of patients and patient education play a huge role in prevention as well. In conclusion, nurses play a key role in the prevention and reduction of falls. Please remember to educate and communicate with your patient and their family members on the importance of safety in the prevention of falls. Thank you for listening and have a great day.